All right, so this question says, a 12-year-old girl comes to the clinic with 3 months of confusion and strange behavior, intermittent diarrhea, and on exam she appears restless and has a rash on her hands and feet. Social history shows no change in diet. A defect in transport in what would cause this condition? So take your time to answer this question and then I'll explain. All right, so the answer is A, small intestine. So a defect in transport in the small intestine would cause Hartnep's disease. So a little bit of background. So Hartnep's disease is a autosomal recessive disease where the transport of neutral amino acids in the small intestine and the kidneys is impaired. And so the gene that causes this is on chromosome 5, and where it has a transporter on the kidney and in the small intestines. So Hartnep's disease can cause niacin deficiency. So niacin is a crucial vitamin, so specifically vitamin B3, which can cause a condition called pellagra. And so it causes a pellagra-like rash. And so that's why the patient has a rash on her hands and feet. So that's the part right here. So that's where that becomes relevant. And so just a little bit of background, niacin, the vitamin B3, is from a amino acid called tryptophan. And so when tryptophan stays in the intestine, bacteria can turn it into a toxic metabolite that's pretty harmful to neurons. And that's why you get the strange behavior and the confusion, because it's neurotoxic. And so the mnemonic for this is the 3Ds: dementia, diarrhea, and dermatitis. And so that's what can clue you in for this question. So first, you have to remember and store this into your memory, these three, the triad, right? Dementia, diarrhea, and dermatitis. So you have the dementia here, so the confusion, strange behavior. You have the diarrhea, intermittent diarrhea, and finally the rash, so dermatitis. So now that you got that, you need the second part, right? Which is there's no change in diet, so it can't be a simple a problem in diet where the patient isn't eating enough vitamins. So we can rule that out. And then you also have to remember that the autosomal recessive diseases such as Hartnep's disease. And then once you have that, you just remember that there's 2 organ systems that are involved in Hartnep's disease. And so you combine all of this together to answer this question. So it definitely takes a little bit of pattern recognition and also recollection to answer this question. But I hope that was a good reminder for you in terms of Hartnep's disease and the pathology of it. And just as a side note, isoniazid, the drug used in RIPE therapy for TB, can also cause niacin deficiency, and that's why we commonly prescribe vitamin B6 if you prescribe isoniazid. So I hope that helped, and thanks for watching.